Firstly, I would like to thank everyone for tuning in. Just a reminder, this is a live segment where you will have the opportunity to ask questions. I will answer questions after I share with you a little bit about myself and my career here at DHR Health. Feel free to submit any questions you may have throughout my presentation. You can submit those by going to www.menti.com and using the access code 1647598. The URL is www.menti, and that's menti.com. So my name is Kareem Abu Hala. I'm an RN. I'm originally from New Jersey, and I moved here when I was 16. My mother's a nurse, and there was a large shortage of nurses here in the Rio Grande Valley, and we ended up moving. I've been a nurse for 9 years, and I've been with DHR for 12 years. My first exposure to, so my specialty is in NICU. So NICU stands for Neonatal Intensive Care Unit, and I deal mostly with premature babies and babies who kind of need assistance and need some kind of support when they're born. My first exposure to this, I didn't know I wanted to be a nurse, really. I started out as a unit clerk there in the NICU. As a unit clerk, really, it was mostly just kind of answering phones, putting in orders, helping out with some of the parents and customer service. And through that exposure, I decided that I did want to become a nurse inside the NICU. It took me about 3 years with prerequisites and going to South Texas College here in the Valley. So the way they do it there is you just take your core subjects, and then you try to get accepted into the nursing program. I specifically went to STC. I know UTRGV has one, and I think RGV College even has an LVN program. But once you're accepted into the program, it was about 3 semesters. While I was working at DHR, I did pay for my own school. But of course, there are always scholarships, grants, etc. available. But just a little bit of an insight, I guess, into what I do in NICU. So mostly in NICU, we do get premature babies who need some kind of support, whether it be oxygen, they need medications, they need IV fluids, etc. But for the most part, it's not unusual even for full-term newborn babies to be in our NICU, even if it's just temporarily. In comparison, I just want to kind of show maybe a difference in size between a regular baby and some of the babies that we deal with. This is kind of what we'd be calling maybe our full-term newborn baby. And in comparison, we get babies this small and like maybe this small and even smaller. Our smallest baby that we've ever had, I believe, was probably around the 500 gram mark. And maybe if you look at from like maybe your elbow to your wrist, that's how long this baby was. So very, very small baby. And I think that's probably the most exciting thing about what I do in the NICU. A normal day in the NICU usually revolves around receiving your patients, assessing your patients, and kind of taking everything from there. So at first, other nurses that I know that I went to school with, they can't imagine themselves taking care of little babies. But it's not as scary, really, as you think. But really, I think most of the training you'll get throughout the nursing program. And then after that, even when you get to the floor in NICU, it's a very small kind of portion of all of nursing, and they don't really teach you much about these premature babies or these babies that need help. So if NICU might be something you're interested in, maybe you want to get involved with babies, but you kind of are scared. Usually, once you get hired in the NICU, that's kind of where you learn most of your role. Things that you do need to be strong with are, especially when you deal with babies and families, okay? A lot of the families that you get are, you really wouldn't even know the NICU existed unless you knew somebody who had a premature baby or a baby who needed that kind of help, I guess, when they're born. But you really do need to be empathetic towards the families. You need to have a positive attitude, not just towards the families and the patients, but also to your coworkers. And you really, really need to have professionalism and critical thinking. So if you do go into nursing, you'll hear a lot about critical thinking. Critical thinking is really just being able to think on your feet. For the most part, I think, especially in NICU, things get bad very, very quickly. Or when a baby's going to be born premature, it's usually very, very sudden. So one day you could just be having like a nice, normal day, and then next thing you know, there's a very, very small baby who was just born and needs help right away. So the critical thinking aspect, you really, really just need to be able to stay calm, use everything you know, use all the tools you know, ask questions, ask for advice, ask for help, and just try to work as a team to help these patients the best that you can. Math, I'm sure you'll find out if you do go into, the healthcare field. Math is always important, especially when you're giving any kind of medications. So very basic kind of math, so-and-so weighs 1 pound and you're supposed to give 2 milligrams per pound. How many milligrams are you going to give? 2 milligrams. It's very once you know the dosages and once you get that training and education, it should come a lot easier. The other types of professions, I guess, that we work with a lot in the NICU, if NICU is something that interests you, we work a lot with physical therapists, occupational therapists, speech pathologists, neonatologists, nurse practitioners, and respiratory therapists, and even ultrasound, echo, and radiology techs. So physical therapists, of course, they're especially in the NICU. So if you guys got already kind of like an introduction to any of these positions, as far as relating to the NICU, the physical therapists do see a lot of the babies when they're born very, very premature and they're always laying down, or they're on some kind of ventilator and they're always laying on their back. The physical therapists go and sit with each baby one by one, get them out of the bed, start stretching them, rotating them, making sure they have like a nice range of motion. You'd be surprised, a lot of the times positioning is very, very important to the baby. They need to be kind of kept in a position which is natural if they were still inside their mothers. The occupational therapist, kind of the same thing. The speech pathologists, of course, they help in the NICU setting. They help more with strengthening the muscles in the mouth and the jaw and the tongue and helping these little babies who weren't ready to eat by a bottle yet be prepared to feed. The neonatologist, of course, that is a medical doctor who specializes in the neonatal field. Nurse practitioners, while the doctor's not there, if you really want to continue with your nursing education and even become a neonatal nurse practitioner, the nurse practitioners pretty much can do almost everything the doctor can do. They intubate the babies, they attend to high-risk deliveries, they order medications, and they see all the babies every single day and kind of make changes to help them, go home a lot quicker. The respiratory therapists help for any oxygen needs that the babies need. They attend to deliveries and make sure they're resuscitated if they need to be. And the ultrasound, echo, and radiology techs, of course, help us with some of the tests that a baby might need. Ultrasounds, a lot of the times they check the heart. The echo tech. The ultrasounds, we check a lot of the baby's heads. They have very, very sensitive heads, brains, kidneys, etc. So usually when we get some lab results that might be a little bit questionable, maybe they'll order some of those ultrasounds. The radiology techs, any baby having any kind of difficulty breathing when they're first born gets an x-ray. It's pretty cool. Instead of, I don't know if who's gotten an x-ray before, but instead of taking you to a room and taking an x-ray of you, they actually have a portable machine that they go and they just kind of take an x-ray of a chest x-ray of any babies that do have that difficulty breathing. I guess some interesting things about NICU, it's not just preemie babies and it's not just small babies that you might be scared to handle or deal with. A lot of the times big babies can be NICU babies too. There's a lot of diabetes in the Rio Grande Valley and even gestational diabetes. And babies who are from diabetic moms typically do have I would say like premature lungs. And a lot of the times they need at least a few days of some kind of oxygen therapy. So if you want to go to nursing school, or if you are interested in being in the NICU, some tips I have is to get some kind of introduction to the healthcare environment. Throughout my time at DHR, I've even seen students round with our neonatologists because they were interested in maybe being a doctor one day and specializing with the babies. I've seen them just come and work as students. I've seen them work as volunteers in the nursery, helping to feed babies. Of course, this is pre-COVID. Or you could be like me. I didn't really know I wanted to be a nurse, but when I first got that job as a unit clerk in the NICU, that's kind of what motivated me to continue going to school and working in the NICU. And I think that might be all, guys. Just ask around. Try not to take, too big a break if you do after school. Try to, take at least some core subjects. Always ask for advice or help. And I would say nursing is a great profession. If I ever decided right now, I do have NICU experience. I've been there for 9 years. I've been a charge nurse there for 4 years. And recently I switched to nursing education. So now I'm actually not taking care of the babies anymore, but I'm working as an educator to all the nurses. So there's always a lot of flexibility as far as what you want to do. You get tired of the babies, you want to go become a nurse practitioner, advance your career, make a little bit more money. You don't want to take care of patients anymore. You can always get to the education side of things like me. You can become a legal nurse. You can, work with the insurance companies to like audit home health charts. So there's a lot of flexibility there as far as nursing. The cool thing is also, as far as working in some of the higher risk settings, like the intensive care units, a lot of the times they really, really encourage you even to be a new grad. So it's not like you have to graduate, work maybe in some kind of position you don't like, and then try to get your chance to go into NICU. A lot of the times we like hiring new grads, especially because they don't have any bad habits. We can train them the way we do them. And right now, as a nursing educator, one of the reasons why I took this job, I'm a unit-based educator, I'm assigned to the NICU, is because I really did feel like I wanted to help these new nurses become very, very strong nurses in the NICU. So maybe if you get hired in NICU, I'll be there to mentor you. And so now I think we are going to take the questions. Elizabeth, I think the screen shut off over here. Okay, so we're gonna try to get through these questions like kind of quick, so especially because there might be a lot of them. So I don't know how to go up. But someone asked me, has a job ever taken an emotional toll on you? Of course. There are times where a baby's just wasn't ready to be born or has too many complications. And of course that becomes kind of like an ethical thing, as far as continuing to treat the baby, knowing that there's like a lot of difficulties the baby will have now and in the future over, maybe sometimes asking the parents like, hey, we think it might be best to, kind of withdraw our care. And I think that's the most difficult part. Sometimes babies are 100% okay. They look beautiful. They're big babies. They're born 40 weeks, full term, everything's fine. And then suddenly we find out, they had something and, they don't make it. So I think a lot of the times, like not just in nursing, but in life, death can be a very, very difficult thing to deal with. So that I think's been the most emotional toll that I've ever taken. Do we slap the baby's back so they can breathe? So that's actually not such a bad question because a lot of these babies, especially when they're born premature, there's that little mechanism. So hold your breath, and then when you feel that discomfort, you'll start to breathe again. You know, you can't hold your breath for too long because your body just wants that oxygen, wants that air. So babies are kind of born with a premature respiratory control center in their brain. So a lot of the times these babies will just be peaceful, sleeping, and the next thing you know, they just stop breathing. In those instances, we don't slap them in the back, but we do sometimes rub their back, or we kind of like, you know, almost like I wouldn't say tickle, but we kind of just like rub their back or just try to stimulate them in any way possible. Sometimes rubbing their feet with your thumb, just to kind of get them to like, you know, kick in their breathing again. Do I miss taking care of the babies? I do. Actually, during this whole time, for a few weeks, we were required to work back on the floor. So it was just kind of very, 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 very comfortable to me getting back on the floor. I was even charge nurse one night. We had a baby that needed resuscitating. That's also the thing. There always needs to be a nurse that goes to these deliveries. And sometimes it's just a normal delivery. Baby gets stuck or something, or you find out, you know, there's something else that they didn't catch before the baby was born, and the babies need help. So I think that's kind of like almost like a little thrill. So, you know, like you like going to these things and being the one to help these babies survive. What was the longest I stayed in the hospital to take care of a premature baby? So we do switch shifts, guys. Like usual nursing shifts, I would say, in most patient care settings are 12 hours. I know sometimes in the operating rooms and things like that, because you just keep getting a patient, getting rid of a patient, getting a patient, getting rid of a patient. Sometimes they do like, you know, 8-hour shifts over the 24 hours. But usually for patient care, you do 12 hours. If things get really busy, somebody's late, somebody called in, there's not enough people to take care of the babies, usually, you know, you'll stay a little bit later. But for the most part, it's just a 12-hour shift. You take care of the baby while you're there. You do everything that's scheduled for that time period, and then you just go home. A lot of the times, especially with nursing, I mean, there's always job availability. There's always, not always, I should say, but there's a lot of opportunity all the time to get overtime. You know, you want to get paid a little bit extra. You're really attached to the baby. You like the parents that you're taking care of, et cetera. I mean, you could just keep coming back, be that baby's nurse, you know, and kind of follow up to make sure that the baby gets that continued care. It's always difficult. I think one of the difficulties of my job when I was taking care of the babies is coming in and like getting to know the baby. So once you have a new baby you never met before, was just born while you were off, you come in, you're taking care of the baby. It's kind of like, okay, what's this baby? What's the history? What's the mom like? What's the dad like? You know, like how does this baby behave? And not like, you know, baby's good, bad baby, good baby's bad baby, but no, how does the baby behave as far as like, do they like us to lay down in a certain position? They breathe better, you know? Do they cry a lot if you try to, you know, put them in a certain position? Do they like having the pacifier there? Does that calm them down? So, I mean, you do need to get to know the baby. I knew this is what I wanted to do also when I became the unit clerk. So I was here as a unit clerk for about 3 months. I was already like, oh, cool, NICU's pretty cool, you know, like we all work as a team. I deal a lot with the parents. I would have to like walk them back and forth, you know, walk them back to the room, show them where to go. Of course, when the baby's first born, let's say it's a C-section, so the baby, you know, was delivered in the operating room. I'll take the dad to see the baby and then go take him back to his wife, kind of like calm them down, you know, if they're scared or they're worried. And then after that, I became the EKG Tech. So I started checking the baby's hearts. So I would go and we'd do an electrocardiogram on these babies, and I would do this test for the babies who, when the doctor would listen to the heart, maybe the heart sounded a little bit, like the heartbeat sounded a little funny. We usually call that a heart murmur. And I would do the electrocardiogram. So just from that, I kind of thought, you know, especially some of the nurses there, I'm like, you know, I already pretty much help out. I'm part of the team. Maybe I should become a nurse. Maybe I should work here. And I did. And I paid for my school by working and going to school at the same time. So yeah, from the experience. So if you feel like this might be something that you want to do, just ask. I mean, you can probably call me even, or call the NICU, or call DHR and say, hey, you know, is it okay if like I come in one day, maybe I can like shadow somebody, or I can, see what the doctors do, if I can, maybe help out with the babies, anything I can volunteer, and hopefully, besides the fact that we're kind of with the restrictions now with COVID, I mean, hopefully they can maybe work something out, either where things kind of like relax a little bit, or you never know. Have I ever grown attached to a baby? Yes. I mean, the babies, of course, when they're so premature, they don't behave like regular babies. They hardly smile, But no, you grow attached to a baby. I don't know what it is about my voice, but sometimes, a baby's crying. I'm just like, I'm like, hey, why are you crying? And, they just kind of stop and they look at you, and you do build that attachment. But I think for the most part, you build attachments to their parents. So you just know some people are just such sweet parents. They're going to be a good mom and dad. Their baby's in this unfortunate situation. They're worried. It's their first baby, or it's their third baby, and it's the first baby ever to be born premature, and they're just scared and they need help. And I think that's really more or less what you grow attached to. Of course, you give every baby the same care. You don't just take care of the babies of the parents you like. Or if you don't like the parents, you don't treat you don't treat your baby or their baby the same. But for the most part, that's what it takes to be a nurse. The same consistent values that you're going to do your job. You're going to do the best. You're going to do your job to the best of your abilities, no matter who it is. I mean, if you're a nurse and you work in the emergency room, and that person that you don't like comes in with like a broken leg, you're not gonna. Oh no, I'm not going to help her. Or I'm not going to help him. So, I mean, you just have a duty to yourself and to the people you're taking care of to take care of them the best way possible. Do hospitals offer therapy? Yes, we do. Our unit specifically does have she's a psychologist. She sits there a lot with the mothers. So a lot of the times, especially if a baby is in that kind of instance where they're considering withdrawing care, or if the baby just doesn't make it, she helps out a lot. Her name's Andrea. She helps out a lot with these mothers. Even when the moms aren't in that situation, baby's okay, but there is a thing called postpartum depression, and she helps a lot with these moms, and you'd be surprised how, I guess, even though their baby's healthy or the baby's only going to be there for a couple days, like, you'd be surprised how much they actually need that kind of support also, that therapy. So absolutely, we do offer the therapy. And a lot of times we're the ones who take care of that. There is something called bereavement care. I've done it maybe 2 times in the whole 9 years I've been a nurse. But typically, your baby's not going to make it, or the parents decide, this is kind of like, let's stop doing this, like torturing the baby. Like, let's just, kind of like let the baby rest. The baby fought hard enough. And then you do have this deep interaction with the parents and the family members as far as kind of saying goodbye to your baby. So we do let them hold their baby however long they want, etc., offer them the support, but there is a time where you do need to say, like, hey, this is like the last time you're going to see your baby, and then, we kind of have to send them on their way. So it's very, very difficult. What are my thoughts on medical marijuana? Maybe this isn't the right presentation to answer that, but I'm sure you can do all your research. It is prescribed in a lot of situations for certain patients, so it is a practice that some physicians use. Is it true that it's good to hear babies crying because at least they are past? Yes, I like when my babies cry, especially at deliveries. So the baby's born, baby comes out really, really floppy with no movement. I get concerned. As a charge nurse in the NICU, you do go to all these deliveries that there's any issue that they're like, for example, if a mom's on medication that might make the baby too sleepy or might make the baby stop breathing. And these are usually any kind of like sedation medications. Moms a lot of the time have high blood pressure caused by the pregnancy. So a lot of times they get magnesium. Magnesium does transfer to the baby, and sometimes they could have a depressed breathing reflex. So a lot of times they come out and they're just not breathing. They're super floppy. You would think already they have no life in them. So in those cases, a NICU nurse would have to go, or a NICU charge nurse would have to go. with a respiratory therapist usually to try to help this baby in the first few minutes of life, making sure that they're breathing okay and assessing if they need to go to the nursery or they need to come to the NICU. And of course, I've brought my fair share of babies. But yes, baby's crying, great. Baby's not crying, like I'm scared. You're scared, but you do your job. And that's probably also the hardest part of my job. What's the youngest age? Guys, as long as you have your RN, there is no minimum age. So I had a nurse now, I think she's maybe like 23, 24 now. She's already on her way to become a nurse practitioner. So she did the speed route. She like got out of high school or got some credits during high school. She went straight to like RN school. She got her BSN. She was working with us already when she was 20, 21. And then now she's almost done with her nurse practitioner. She's like 22, 23. In comparison, I started working in the NICU when I was 22. I got my RN by the time I was 26, and then now I'm 34. So I'm already in my 9th year. But yeah, the faster you get done with school, the sooner you can work as an RN. Age is not an issue. How many years of college is needed? So the program that I went through is called the Associate's Degree of Nursing. The Associate's Degree is usually 3 or 4 semesters. So it's usually 4 semesters, but a lot of the times at STC, they offer a summer semester where everything's kind of like you go to school a little bit more, like you go probably nearly every day, but it's a lot shorter. So I think I went from a fall, a spring, and summer. And in the summer, you take like 2 different semesters, but they're all cramped together, and that was pretty much it. So you know, you go to STC, you go to your counseling, you ask them, hey, I want to become a nurse. Can I see the program? Like the list of classes I need to become a nurse, and they'll give you the prerequisites you need to take. Take those online even, now that you guys are so used to taking online classes. You know, take those online, all your prerequisites. Sure. I pretty much took all my prerequisites online, besides, I think, microbiology. I think I took a college algebra during the summer. I probably took like a history during the summer, but for the most part, I was working at the same time, so I did most of my stuff online. Once you're there, it's really just that 3 or 4 semesters at STC. The RN program, very, very demanding. So the question was, how demanding was your RN program? Super demanding. They do try to prepare you to the best of their ability for being a professional. So if they say, hey, this is your uniform, you're going to be wearing that uniform every day. This is your dress code. This is how you're going to wear your hair. You're going to cover up your tattoos. You're going to take out your, any piercings that might be a little bit inappropriate, et cetera. And you're not going to wear them to the hospital. Like that's what they hold you to. The worst part, but it's also a good thing, I would say, is the nursing programs. The nursing programs, I feel, have a high, like they put a lot of value in you passing your test when you finish. So in order to make sure that you do that, they do kind of set the standards a little bit higher. There is no C's get degrees. If you have a grade in the 70s, you actually do not pass that class. They want to keep you kind of like in the 80s and higher, just to make sure that you're really, really grasping all the concepts, et cetera. And as far as the dress code and everything, guys, like it's just, don't try to break their dress code because they will find out. But no, for the most part, it was pretty demanding, but you really have to be committed. If this is really what you want to do, you'll have no problem being committed. Sleepless nights while learning to be a nurse. I believe so. And it's mostly probably my fault because, maybe I'm a little bit behind on something, or I decided to work and go to school at the same time. Instead of just focusing on school. So yeah, I've had it, but I really think if you're lucky enough to be able to just go to school and not have to worry about working, great. Like it should be no problem. You should have enough adequate time to finish all your work. Was I nervous the first time I had to deal with babies? Yes, absolutely. But they're a lot more resilient than you think. Babies heal faster. They recover faster. They're very, very resilient. They don't you pick them up and his head's really weak because there's no neck muscles. Their head doesn't roll off or anything. They're very, very sturdy. You just have to hold them the right way. And usually they're so small that typically just one hand kind of on the back of the neck and the head, supporting the head, and then your palm kind of covering their back, and then just maybe grabbing their legs and their lower back, and just like this, and you can just move your baby. So is this how I would really hold a baby? Yes. So a very, very small baby, I would hold like this. What kind of food did I rely on during college? To be honest, since I was working and going to school, I would rely on everybody's leftovers in the unit. So a lot of the times, especially these nurses, their big thing is like ordering lunch. So whatever they had there that they ordered too much, they'd be like, hey, Kareem, you want some? I'd be like, yeah, sure. How do you calm down a baby when they're crying? So we use a lot of the times a pacifier, or the most common way is kind of like touch. So babies, a lot of the times, they don't want to be alone. Remember, when they're inside their moms at this age, they're curled up. They're all like in a ball, and they're just like really, really compact in a warm area, floating around in mommy's tummy. And then now they're born and they're like this. So a lot of the times, you know, you just kind of like hold them. You kind of like give them like a hug kind of with your hands. And if you just like do this, like if you kind of just like hold their hands by their face and you kind of just like scrunch them up and just like put your hands on top of them, they usually stop crying. What was the hardest class I took in college? Microbiology, by far. It was kind of hard for me to grasp. A lot of bacteria names, a lot of things like that. But, you know, it depends on who your instructor is. You'll tell me, right, Elizabeth? Okay. So I think we're coming kind of too close, so I'll try to answer as many questions as possible. Do you recommend this if you have a fear of hurting them, or do you think it can be overcome? Okay, if your only fear is hurting the babies, absolutely. I feel like you can overcome that. Once you start taking care of them and actually seeing like how... And of course, guys, like the smallest of the babies are more reserved for the nurses with the most experience. So it's not like you're going to be a brand new nurse and they're going to be like, hey, that's the toughest baby, go take care of that baby. You will work your way up to that once you kind of know, once you kind of gain the experience and gain the trust even of the doctors there, you know, in your NICU. But for the most part, yeah, if you just feel like, you know what, I might hold him wrong, I'm going to hurt him. Like that absolutely, once you get a little bit of practice, that will 100% go away. If you don't feel like you're the right person for NICU, but let's say, for example, they pay you the most or something, I would not recommend you going to NICU. There has to be really like your heart into it. If you're not compassionate, if you're not, don't have that empathy and really, really go the extra mile. For example, me, it doesn't matter how busy I am, even if I'm 30 minutes behind, an hour behind, you know, there was a surprise delivery and I was taking care of that baby, not as the charge nurse, but just as the floor nurse. And I'm super, super far behind. But the parents of my other baby are calling, and that baby's totally fine. There's nothing going on with that baby. Really, I stop everything I'm doing, and I don't say, like, you know what, tell her I'll call her back, or tell her her baby's fine. Like, I will take the time and stop everything I'm doing, go talk to that mom, because you know what? The most important person to the parents is their own baby. So, I mean, some parents are at home, they're worried, they have other kids to take care of, et cetera, et cetera. You don't make the time for them, or you feel like, you know what, you're more important than the babies, and what you want is more important than who you're taking care of, that's when I kind of feel like you're doing it for the wrong reasons. So yeah, nurses get paid very, very well. Yes, you can keep going to school and make more and more money. Yes, you can work overtime and make more and more money. You can travel the whole country, and they'll pay you extra to travel the whole country, you know, and live in different cities and try different foods and whatever, but you'll obviously be traveling as a nurse. So nursing has a lot of great things, guys, but you really, really have to have at least that empathy within you. Have I ever felt guilt? No. There's a lot of times you can't do anything. I would understand if you make a mistake. You might feel some kind of guilt, but guys, that's why they train you so hard, and that's why like you practice so hard. Like there's always that little thing inside you where I mean, once you get into nursing, there's very, very small, tedious things. Like they'll be like, hey, before you give that medication, make sure you check their ID bracelet. You ask them their name, you ask them for their date of birth, whatever. With the babies, we scan them, and then we scan their labels inside their little crib or isolette or whatever they're in. We have to be there at the bedside. We have to ask another nurse to come and check with us and sign us off on the computer. And the reason for all of that, guys, is to avoid making mistakes. So if you really follow the rules and you do all these little tedious things and don't cut corners, you'll never make a mistake. So you will never have that guilt. Has anyone ever dropped a baby in the room? Not a nurse. And that's just here at this hospital. I'm sure it's happened before somewhere. But which ones are easy to take care of, males or females? So don't be mad, but females. Females are stronger. They don't cry as much. They, are born very, very early, and they rarely have any issues, like, as far as males. So males, a lot, the little boys, they really, really do, I think, usually have, like, a more difficult time statistically. But, I don't know why. But go girl babies. How do you do compressions on a premature baby? With your thumbs. So there is in regular CPR, of course, guys, you do your compressions like this. On babies, you'll actually, with the baby laying down, you'll just grab them under their arms and you will just push. So as a nursing educator, I actually got my NRP instructor's license, and NRP stands for Neonatal Resuscitation Program, and I actually teach this too. So even if you ever want to sign up, you could kind of buy the program and, but yeah, you do it like this. And I think they even kind of show you this in BLS for the bigger babies, so it's pretty much the same. What was the largest weight baby we've had? Maybe like 11 or 12 pounds, and they're just like really, really huge. So the more, I would say these babies are typically babies from diabetic mothers, but just that increase, I think, of sugar in the baby's blood just kind of helps them have what they call, I guess, like Texas preemies. So sometimes, you'll have a full-term baby that's just huge, and sometimes you'll have a preemie baby that just looks like a normal baby. And those are called, at least in our unit, we usually call them like Texas preemies, and they're just, they're just bigger because of, I guess, like all the sugar they've been getting. And I think, does that sound like it? That's all? Okay, guys. Well, thank you for tuning in. Again, if you have any questions, try to reach out. Maybe find a phone number where you can contact somebody should be able to help you. I don't even mind you guys contacting me. If you want to ask for me, maybe I can help at least redirect you into the right person to help you maybe, explore NICU or explore nursing or explore any of those other jobs. Just let us know, and we're here to help.